Welcome, everyone. I'm Ruth Hendricks, and I'm the President and CEO of Lutheran Family Services of Nebraska. I want to thank you all for coming to help us celebrate the opening of Health 360 in this new location for Lutheran Family Services. I don't know how many of you know that LFS of Nebraska has been in this state for 124 years. And very quietly, for a lot of years, 45 to be exact, we've been here in Lincoln. Most of you probably didn't know that. This beautiful new office building signifies the expansion of the LFS footprint here in Lincoln significantly. In 2013, LFS was awarded the Core Behavioral Health Services when Lancaster County there was a proposal that was put out through Region 5. We were awarded that particular contract, which transferred the outpatient mental health services to Lutheran Family Services. And it wasn't much after the day that happened and we had the conversation with CJ that we were approached at LFS and asked if we would consider being the lead organization for a vision that this community had to create what you are going to see in this building today and what we call Health 360. Health 360, as I said, really began as a vision of the leadership here in Lincoln, and then it was really picked up on by the Community Health Endowment, Lori Seibel's group, and this just became a project that kept moving along. It's my understanding that in 2004, Lincoln actually had a Robert Wood Johnson's grant, and the title, I believe, was called Urgent Matters. And this community began taking a look at how do we deliver the best possible care that we can to the most vulnerable in our city. And it specifically said back in 2004 that must include those people who work and live with severe and persistent mental illness. Today, many years after 2004, it is obvious that this community has continued on that path, and we have now gotten to 2016, and one more block is in that path, and that is the grand opening of this facility, Health 360. Yeah, it is worth a clap. Thank you. So we talk a lot about integrated care, so what the heck is integrated health care? And I think that simply for me as a lay person, I think that I would say integrated health care is the delivery of behavioral health care and primary health care in the same location. And here we actually have pharmacy on site also. That care is also delivered at the same time. It's more than just simply locating in the same building. You actually can see all these different providers with one visit, just one visit. So in this building, on our team, we have physicians, APRNs, we have nurses, behavioral health specialists, medical assistants, and pharmacists that are all working together. I'm told that in the morning, if you're here bright and early, there's what they call a huddle, and they huddle in the clinic, and they talk about who's coming in today, and what is it? Do we need the behavioral health specialist there? What's going to be the special need of this particular person coming to the clinic today? So it is a special place, and it is a place that maybe not everybody wants to work. We're hoping everybody's going to want to work here. This building that you stand in is a reflection of the dignity and the respect that LFS of Nebraska believes is due to everyone. It's due to everyone regardless of your race, your gender, your creed, or your religion, or your income. So this building, and deep in my heart, this is what we need to do for everybody. This is a clinic that I'd be proud to go to, and I think that all the rest of us standing here, we would feel good. And this is the dignity and respect that we believe at LFS all people deserve. So when people walk through those front doors right over there, they're going to be greeted at this counter. Notice, it's one counter. Not two counters, not three counters. Everybody who comes in goes to that counter. And then When they go on the other side of this wall, they all go through one door, that door over there, which says welcome. It's not the entrance, it's welcome. And everybody goes through that door, whether you're here because you suffer from schizophrenia and you're going to go see a mental health therapist, or maybe you're here because of your diabetes and you're going to go to the clinic. Maybe you're a refugee newly arrived. Doesn't matter who's coming here. We're going to go in through one door and we're going to come out through the other door. We are trying very hard in this building to reduce the stigma and to be a welcoming place and a place of hope for people who many times don't feel that hope. So we're perfectly located. Maybe this is by luck. Maybe the mayor knew something about this. I don't know. But we really are located in the perfect place for maximum outcomes. According to a 2015 Lincoln Vital Signs study, which I'm sure you've all read and memorized, my staff know it inside and out, in the year 2000, Lincoln, Nebraska had no neighborhoods in extreme poverty. Just the year 2000. And by the year 2013, Lincoln had 6 neighborhoods in extreme poverty. This location, 23rd and O Street, where you stand right now, is in the middle of those 6 areas. We are in the right place, doing the right things. And LFS doesn't do this alone. We have 2 of the best partners that make integrated care happening. We have People's Health Center and Genoa QOL Pharmacy. This wouldn't have happened without Brad and his team and the pharmacy team. I also want to recognize for you a few other community collaborators who are, or very soon will be, moving into this building. They're not all quite moved in yet, but they will all be offering services here. So this is not a one organization show. This is the community coming together. So it won't be long before the Lancaster County Health Department care coordination nurses will actually move into their office in this building. The Community Crops Veggie Van is now coming here every week, and they're parking right out there in the parking lot, and we are going to encourage the clients who come in this door to be able to have access to healthy food, and we're going to role model in this whole neighborhood what it means to be healthy. We have bike trails, and we have a veggie van now. Community Action Partnership is soon going to open. If you look down that hallway, you just see a door that's kind of pasted over. In October, that door will open, and VICE will open up the new Head Start, Early Head Start program. And so children will be able to be there and have just immediate access to all else that is in this building. And legal aid. I saw Milo here, I know he entered sometime. Legal aid is moving in, and they are going to bring legal assistance to all the people who are coming into this building. So this is a partnership. This is holistic health care. This is caring for our people with dignity. So LFS is also in this building with all of the services that we were already doing in Lincoln. So we're bringing our full array of outpatient mental health and substance abuse services, our community support services, medication management, and our at-ease services for veterans. That's all. LFS is bringing all those behavioral health services. And we're going to also continue to have our LFS staff in other Lincoln locations, partnering with Centerpoint to deliver the peer program services, and we're going to continue to partner with the Bridge, Houses of Hope, and Blue Valley on the TASK program. So we're going to keep those also going. In this building, you'll also find LFS Children's Services. So we've got here the parents and children will learn to interact and have healthy ways of talking and being together. They're going to be coached by therapists we have two-way mirrors in some of the therapy rooms in the building, and so parents will get headsets and they will be able to be coached by therapists on those healthy interactions. We also have our RSAFE program here. RSAFE is a program LFS has done in this state for over 20 years, and we provide services for children who have been impacted by child sexual abuse and trauma, and we will continue to offer them here, but we also offer them at another location in Lincoln, at the Child Advocacy Center. So we partner with them in doing that program also. So for all that we do in this building, the LFS statewide vision, the vision of Lutheran Family Services of Nebraska, is safety, hope, and well-being for all people. And that is exactly what LFS and Health 360 are going to do every day in this building when the doors open. Thank you all for coming. Lots of special guests here today, and I also get to introduce them before I introduce the mayor. I hope I don't miss anyone. I haven't been all the way around, so my first introduction is a little off script. My first introduction is not the dignitaries and the elected officials. It is the introduction of the Vice President of Program of Lutheran Family Services of Nebraska, Mr. Todd Reckling. And I don't know where Todd is, but we are going to find him. Get out here just a little farther. Todd Reckling has been the captain of this ship at Lutheran Family Services. We would not have walked through those doors today if it had not been for the commitment of Todd to this project. He grabbed on to integrated care and he made this happen, and I'm sure there were days when you believed you did it single-handedly, and you did in some ways. You on many ways did. Todd was the one who led LFS in the RFP process with Region 5. He worked on the development and then the implementation of the program that is happening in this building. He worked on the building design. He is the one who hired the leadership of the program of Health 360 here in this building. So I start first by saying thank you to you with all my heart. And I also want to introduce to you the woman who is running the programs in this building, Shirley Terry. Where is Shirley? All right, and there's Shirley. Shirley is the Chief Operating Officer of this facility. Thank you very, very, very much. As I said, Lutheran Family Services is a statewide organization, and so we have members of our board that are here from various parts of the state, and I just want to acknowledge, and when I call your name, if you just wave your hand so that people know. And I'm also going to call the names of the folks who are here from our LFS Foundation board. I know that I saw Connie Duncan come in. Well, hi, Connie. Linda Doherty, somewhere around here. Gwen Edwards. Brad Holtorf, somewhere. Reverend Richard Snow, he's back here. Did I miss any LFS board members? Okay, and from our LFS Foundation board, I know that we have here Terry McLean, Pete Zandbergen, Larry Novicki, and Andrew Morrow. Let's thank them all for this vision. So now I'm going to ask for the bravery. Are there any state senators here? Okay, we're moving on. I thought he was too, but now. All right, State Senator Mark Coulterman is standing right back there. Welcome. I thought you were going to be here. And our representative for this area from the Lincoln City Council, Carl Eskridge. Thank you for being here. Thanks to all of you for your courage and your vision. So now it's time for all of you to join me in welcoming to this podium probably one of the earliest champions in the city of Lincoln to this very project, our Lincoln Mayor, Chris Beitler.
Oh my, What energy there is out here. Huh? Can you feel it? Wow. Here at last, here at last. Thank God Almighty, it's here at last. I am so happy to be here. This is something that city government in Lincoln has wanted for a long, long time. Back in 2007, when we came into office, one of our primary goals, already here, I just kind of picked up on it, but Judy Halstead with our Lancaster County Health Department and Lori Seibel and many others were on the path to finding a medical home for every citizen in this county. And that sounded really good to me. Everybody should have a place to go. I think we all agree to that. This kind of facility is a proven way to hold the line on healthcare costs, and ultimately, and most importantly, it's a way that has results in terms of healthier people and a healthier community altogether. So now, here today, on a revitalized stretch of O Street, a wonderful, large medical home is opening, and it's a beautiful, beautiful thing. And talking about the revitalization of O Street, this is a part of a bigger thing in a different way also. And I want to thank Bill Langdon and Benny McComb and the developers who did such a good job on this and who gave of themselves in the process of doing a good job on this. I think they deserve a hand too for the facility. The city participated, of course, through financing mechanisms as well as other ways, and our urban development department was highly involved in the formulation of that financial partnership. And I want to thank Wynn Hermstead and the whole department at Urban Development for their role in this. Thank you, Wynn, very much. Most of all, I want to thank Lutheran Family Services, Ruth, her whole team and staff, and all of the other healthcare partners for their collaboration on this project. And there was a great deal of collaboration over a long period of time, and people started coming together and working together, and that large public-private partnership in the end is what made this happen. And what happened here, as it turned out, was perhaps a bigger thing than any of us actually envisioned at the very start. This became not the traditional medical home, but this is becoming a national model for integrated care that addresses the whole person. Treating the whole person will best improve the health and well-being of some of our most vulnerable citizens. Services including primary care and behavioral health and dental health and prescription drug needs will be provided, of course, in this one location. And by offering all these services under one roof, the patient's privacy and dignity will also be better protected. I had the pleasure of getting a sneak preview prior to this opening. Thank you, Shirley, for a very detailed tour. She took time out from one of her hectic days to walk me through this awesome clinic, and I thank you very much for that. I can affirm that patients are indeed going to get quality care. The people, the space, the equipment is top-notch, state-of-the-art stuff. So I'm extremely impressed and proud that this clinic is in Lincoln, Nebraska. I finally want to thank Lori Seibel and the Community Health Endowment for investing in this project. I think they, if I'm remembering right, they not only participated in the renovation of the space, but provided some initial operational costs as well. And the Community Health Endowment, as I think many of you know, has been an integral part of improving the health of this community in so many different ways, including this one. So thank you, Laurie, for getting your team together and pitching in on this big effort. Also excited about the Head Start program, opening in October, serving the same families that are utilizing this health clinic. That was frosting on the cake, and is going to be a wonderfully productive arrangement for many of our families. Lincoln has a long and positive history with that particular child care program, and I'm very happy that a lot more children are going to be prepared for school, and a lot more parents are going to be prepared to help them to school. So congratulations to everybody involved, absolutely wonderful. And another guy who made all this happen was Brad Mayer at the People's Health Center, and he's going to have a few words for us right now.
So I am not as good of a speaker as Ruth or Mayor, so just kind of bear with me. Appreciate everybody coming here. It's a great attendance. I've been at People's Health Center since September of 2014, and Shirley's predecessor and I started on the same day, and we were told, okay, go build this clinic. And so we had about 4 months to get it up and running, and it started at the old Community Mental Health Center at 2201 South 17th Street. It was kind of what I call our practice clinic. We had a nurse practitioner, a couple nurse practitioners, just trying to figure out, where the social worker plays in, how it mixes with the primary care team. And it was really difficult. People's Health Center is a federally qualified health center. And what that means is we provide care for the uninsured and underinsured. We see about 10,000 patients. We'll have about 11,000 at the end of this year, and next year with the expansion opportunities, we'll be over 17,000 patients. We know how to do primary care. We know how to do medical care. We're very good at dental care, but behavioral health is very new to us. And so it's scary whenever you get into this. But working with Lutheran Family Services, with Todd, with the staff, we had a vision of what we wanted to accomplish. And, it took a lot of tweaks, but I think we've got it to a point where it's starting to become efficient. We are shooting for a nice payer mix. We're not quite there yet. To become sustainable, because that's CHE's requirement of us. They gave us $1.25 million. $500,000 of that went to help build the clinic, and then $750,000 over 3 years to make us sustainable. And so that's our goal, is to become sustainable without any other gifts, and so we've got a lot of work to do on that. But we have one physician, one nurse practitioner. We're adding another nurse practitioner. We've got a dental hygienist that is coming 2 days a week. We're hoping to eventually put a dentist here. And so when we talk about wraparound care, that's what we're trying to do. Health 360 was the start of this endeavor, but since it's been so good, we're actually carrying it across our entire organization. We have 3 sites right now. We'll have a 4th site next year, and we have future opportunities. And so those 17,000 patients are going to have better health care because of what Health 360 started for us. We're always focused about the patient. We're always trying to figure out how we can do things better. We're not perfect. We don't claim to be. But in 2 years, we're going to look back on this and say, we learned a lot. We can still keep learning. In 5 years, there's going to be new advances, new technology. We'll still be learning. This is not, the day that learning stops. And so the next 5 years, next 10 years, we'll always be learning. We'll be growing. We'll be expanding. We'll be adding other opportunities. And so I just appreciate Lutheran Family Services and CHE and all of our health partners. Genoa Pharmacy. It's great having a pharmacy here. If anybody of you have to go see your doctor, drive across town to the pharmacy, pick up your meds. It's nice to go in one door, go out the other, give them the script, and then walk out the door. It's great. And so I just appreciate everybody coming here, and thank you very much. And I'm introducing Natasha Hennessy. She came in early on when we were designing the clinic. She's the Director of Operations for Genoa Pharmacy, and so she's going to talk about Genoa.
Wow, what a great turnout, and what a fantastic building and partnership to celebrate today. My name is Natasha Hennessy. I'm the Director of Operations for Genoa. I oversee part of the Midwest, which includes the great state of Nebraska. Genoa operates on-site, full-service pharmacies that specialize in behavioral health. We are honored to be a part of Health 360 as part of their integrated treatment team. Genoa services are designed to enhance the already excellent services offered by Health 360. We have the same goal, and that is to provide integrated continuity of care to ensure the best possible outcomes for our consumers. Our partnership with LFS and People's Health Center started back in February of 2015, so we're about a year and a half in, and we are looking forward to many years to come. I do want to give a quick thank you to my pharmacist who's on site every day, Karen Soward. She's here every day. So she's been on site, at the new location and the previous location every day for the last year and a half, and has worked really hard to get us up and running and formed great partnerships and relationships with the employees that work here. And also Ashley, our technician, I don't know where she is. So she's here every day with Karen also, so I wanted to give a thank you to her as well. And I will be introducing Lori Seibel, who's the President and CEO of Community Health Endowment of Lincoln.
Good afternoon, everyone, and thank you so much for being here. What a terrific day. Ruth called me and asked me if I think as the historian of the project, would provide a little history. And as I thought about it, I thought that might make for a very, very long afternoon. And so I'm going to sum it up really quickly for you. And that is to say that this project has had twists, it's had turns, it's had bumps, it's had spirited discussion, it's had all of those things, but I really, really believe that's how the good work got done. And I can tell you that throughout all of that, every twist and every turn, one thing that stayed constant is that the community wanted this to happen. And if I had to say the one thing that I heard, the statement that I heard more than any other statement this entire time, it was, this is the right thing to do. It's just the right thing to do. And so if there was ever a time when we needed some sustenance to keep moving, someone would say that, and we believed it, and I still believe it today. So I look today at this beautiful facility that does not look like a grocery store and that does not look like an office supply store. And people ask me if I'm proud, and I am proud. It's beautiful. Todd, Ruth, all of you have done great, great job here. But I'm going to echo something that Ruth said. And out of this entire beautiful facility and all of the state-of-art equipment that's here, I am proudest of one single door. And that is that door right over there. I can't tell you, probably without getting a little choked up, about what that door means to this project and what that door means to the people in this community. One door, regardless of why you're here, one door, no stigma. And we should applaud that single door. I am grateful to Lutheran Family Services and to People's Health Center for not running when this idea was dropped in their lap. Literally, you got the contract, you came to see me, I said, I have an idea, and that was it. And we began the process of getting here today. So I want to thank them. I want to thank the mayor, Mayor Beitler, Carl Eskridge, simply for caring so much about this project and always asking me about it whenever we would see each other. I appreciate that very much. I want to thank the Community Health Endowment Board of Trustees, both past and present, and I would love it if you would raise your hands. I know there's many of you here, but this they were in this project for the long term. And that's not easy to do. It's not easy to stick with something when people tell you there's more ideas and different ideas, but they stuck with it. And they're here today. And I want to give a special thanks to Kim Russell, and I know Kim is here. Kim, who was the chair during a good portion of this period of time, and she and I had many conversations about this, and I greatly appreciate her leadership as well. And I especially want to thank the countless people in this room, many I will not begin to mention, but many of you who have already been mentioned, who did some really, really tough work. Because developing new partnerships is not easy, especially sometimes in an environment that's pushing you to work separately. You guys work together, you learn to trust each other, you learn to believe each other, and that's why this is here today. And so I'm grateful for that. And I will tell you that in a world that right now is filled with so much division and so much disagreement, the fact that we were able to do this in our community should make everyone here very proud. So I know we are all ready to move on, but I want to give 1 minute to moving on and talking about the future. And in homage to our Head Start friends who are going to be opening over here in October, which I am so excited about, I want to reference a children's book that is on the shelf at our home. And it's called The End of the Beginning. And it tells the tale of a snail named Avon and of an ant named Edward. And Avon, the snail, believes that in order to have a happy life, you have to have adventure, and he's never had one. So he and his new friend, Edward, set off on an adventure down a branch. And you know what? About halfway through the book, Edward and Avon get to the end of the branch. And Avon, being new to this adventure thing, says, well, there's the end of the branch. But you know what? Edward responds, and these are the words I want to leave you with today, is that there's the beginning of the sky. So when people ask me if I'm glad this project is finished, I stop short of leaping into the air, and I want to remind them and you that this project in no way represents the end of anything. It is not the finale here. This building, I think, better represents the beginning. It represents the foundation, if you will, of what the community can do through this project and projects like it. So in a few short months, that's already taken place. We have the Head Start, we have the veggie van, we have legal aid, we have the health department services. They're all growing this vision planted right here in the heart of Lincoln. So as you leave here today, leave with the idea that this does not represent the end of the branch. It only is the beginning of the sky, and keep that in mind. And I just want to thank all of you and say congratulations to all of you for being part of this great effort. And I am to introduce Kyle Fisher from the Lincoln Chamber of Commerce.
Well, thank you, Lori. Yes, my name is Kyle Fisher. I get the privilege of representing our Chamber of Commerce here today. On our behalf, our part in this ceremony is pretty easy. We provided the Chamber of Commerce kind of day, and we brought the big scissors. So our role is pretty easy. We get the privilege of doing around 100 of these a year. And if you do the math, that's about 2 a week, and they come in all shapes and sizes. some incredibly large like this, some incredibly small with only a dozen people or so. And so to see this crowd and this dedication is great. As a Chamber of Commerce, we're excited to see what benefits this will have for our community and how we can work together moving forward to improve Lincoln. And with that, we'll do the fun part, and we'll get to snap the big scissors shut and cut the ribbon. So, Mayor, come on up. Have your team come on up here. All right, now we're ready for the big moment. 1, 2, 3.